Hello and welcome to Ethics in the News. My name is Hannah Storm and I'm the Director of the Ethical Journalism Network. In this edition I've been speaking with Professor Anthony Feinstein, who spent many years researching the impact of journalists' work on their mental health. I began by asking for his advice on how members of the media could manage their own mental health during these uncertain times.
So the big challenge that people face right now with Covid-19 is anxiety. There's a lot of anxiety around, and the anxiety is being driven by multiple stressors. A little bit of stress in one's life is good for you because it stimulates you and gets you going and can motivate you. But when you have overwhelming stress or multiple stresses all stacking up on top of one another, then you find anxiety ratchets up. And the big challenge that people face now is managing that anxiety, and at the same time having to recognize that there are many things in their life that they cannot control. And this lack of control, I think, is one of the big stressors which is making people so anxious. And so it's important to understand that there are going to be multiple aspects to the COVID pandemic that you can't control. And you can't control the virus numbers. You can't control mortality rates, economic news, unemployment, things like that. There are big items out there that you cannot control. And when you switch on the news and you listen to the news, it can become a litany of one negative thing after the other running into one another. And so people start thinking in a catastrophic way. You just kind of focus on all these things you can't control, which becomes overwhelming. So you have to avoid this tendency for what we call catastrophic thinking, to go from one negative thought into the other. You need to recognize that. And when you have that insight, you need to break that.
How do we break that catastrophic thinking? How do we regain control?
So you have to make a list of those things in your life that you can control. You can control the amount of time that you spend working on something. You can control when you step back from your computer to do something else. You need to build into your day-to-day activities the kind of things that nourish you that are not related to the COVID or work, such as maybe doing a bit of exercise or listening to some music or some quiet reflection or meditation. You need to factor in some time with your family in which you don't talk about the infection, the pandemic, and all the negative news, but you just focus on different things. You need to eat healthily. You need to make sure that you're paying attention to your sleep, so you're getting an adequate night's sleep, so that when you wake up in the morning, you're refreshed and you can better concentrate on what you're doing. And I think there's a critical variable in all of this, which is respite as resilience. And I want to repeat that, respite as resilience. And what I mean by that is that you have to build into your day respite from the COVID story, from the news about COVID. And you take respite in activities such as being with your family, sitting down for a meal, going for a walk, doing some exercise, listening to music, maybe some mindfulness meditations. You know what works for you, but you have to structure your day in such a way that you allow adequate time for this. It cannot be a all-encompassing focus on a negative story, because that will start wearing you down, particularly as the COVID pandemic is going to be with us for quite some time.
I can imagine there might be quite a lot of pushback in that regard with regard to journalists, because, we feel like this is our job. This is our job to tell this story. We feel like we can't disconnect from this story. What specifically should journalists be doing to ensure that they take respite to build resilience?
So you structure your day in which you build into your schedule each day these periods of respite. It's absolutely essential that you do it. And news managers need to understand that this is essential. And in my talks with news managers thus far, I believe they get this. People realize that this is an unprecedented set of circumstances, and that is going to be pivotal for journalists to remain healthy. And one way to keep people healthy is to take respite through activities that are unrelated to work. And so I think it's a message that has to get across. And I think news managers understand this. The big challenge that the journalists face right now is, number one, you don't want to get the infection, of course. But the bigger issue, I think, is going to be the mental health issue. So how do you sustain your mental equilibrium? How do you manage your anxiety for what is really going to be a very long journey? Because this is not going away soon. So you have to be able to keep an eye on what's coming down the road and to ensure that you're well, because if you're not well, you're not going to be able to function adequately as a journalist.
We have spoken before about the need for journalists to set boundaries, to establish parameters around their roles and responsibilities, where their job begins and where their job ends. How much of an issue are you seeing that to be in the COVID-19 crisis?
There are a lot of desperate people out there who are reaching out to journalists for help in ways that journalists might not be able to help them. So they're asking journalists to step outside their role as journalists to provide all sorts of assistance to them. And while I can understand the impulse of a journalist to want to help, you just have to be careful that you don't overreach yourself and extend yourself and do things that really are way outside your skill set. You have to be careful of, no good deed goes unpunished. Just be careful in terms of what you offer people, what you commit to, because it's a slippery slope to getting in above your head and getting yourself unwittingly into some difficulties. So I'm not saying to journalists, put aside your humanity. No, you can't do that. At the same time, recognize there's a limit to what you can do, and just be aware that you don't have the skill set of an aid worker or a humanitarian worker, and you don't have those resources. And if you take on that role, then it's going to complicate your life and potentially leave you more vulnerable to emotional difficulties when you can't deliver what people expect you to deliver.
We've spoken in the past about this concept called moral injury. Is there any instance you could imagine here where moral injury might be something that journalists risk?
In the desire to help people, journalists can unwittingly take on a task that they can't fulfill. It's just too big. What the general public's asked them to do something and they can't do it. And so then the journalist can have a sense of failure. I failed in what I was hoping to do. And that can be the opening to moral injury. Moral injury, of course, is an injury done to one's moral compass by an act that you've done or you failed to do that you feel transgresses your code of ethics. And so this is the perfect example of it. You'd like to help, you try and help. This is outside your skill set. You can't achieve what you hope to do. You have a sense of failure, and it comes with guilt. So a sense of moral injury that I failed, I didn't do enough. I wasn't able to help this particular person. But you've got to stop yourself, because if you go back and think logically about what you've done, you probably didn't have the skill set to take on this task to begin with. And so in a sense, you're setting yourself up for failure, despite your good intentions, and that can become the gateway to moral injury. And I'm seeing it. So you have to be very careful of moral injury in a situation like this. And as we know, moral injury comes with some prominent emotions like guilt and shame. It's difficult enough to deal with the stresses of COVID without taking on the burdens of guilt and shame. So that's just going to make your role as a journalist much more complicated, much more emotionally fraught. And so once again, just beware good intentions. I'm not saying put aside your humanity, but realize that there are going to be things over here you cannot solve.
What message would you give to managers in terms of supporting journalists who might be at risk of moral injury? Most of us are working remotely now. There's that sense of isolation. How important is it that managers communicate and validate the work that journalists are doing, much of which is obviously essential?
Managers need to check in with their staff, say on a weekly basis, just to ask them, how are you doing? How are you managing emotionally? To let them know that it's very important that they look after themselves during this stressful time. This is going to be a long, hard slog. So be sensitive to that. At the same time, validate the work that the journalists are doing, because they're doing wonderful work. And then, put across this principle of respite as resilience. I think, it's a very simple but profound idea that you can build up your resilience through taking respite from bad news and from this relentless focus on the pandemic.
I'm speaking with various different managers and people in newsrooms, and a lot of them are saying that the work that's been done in the last few years around mental health has really helped them embed this into the conversation early on in COVID, the response to COVID-19. Just wondering your take on that. And also, you said before that the mental health issue is going to remain with us for a long time after COVID-19. Just your reflection on that as well.
One's glad to hear that there has been a sea change in the attitude to mental health over the years, and I think that's come about because of good research that's come out in which you've got empirical data to show that, of course, journalists are not immune to psychological difficulties. And in many ways, given the nature of your work, which is often on the front lines of very difficult stories, you're potentially quite vulnerable to psychological challenges. So it's really good that news organizations are starting to get it, because as you know well, going back a decade or so, there wasn't much discussion about this. So this sea change is good. Obviously, the first priority with everything is you've got to stay physically well. You want to be physically safe. So you've got to take all the right precautions to minimize your chances of getting the virus. That's absolutely essential. That's the number one priority over here. But in doing so, you can't take your eye off an equally big ball, which is that this is an enormously stressful time. Lives have been turned upside down. You can just stack up stress after stress after stress. And so you've got to be aware that mental health issues are going to be prominent over here, and you have to be able to address them and do it proactively. Don't go scrambling to try and solve something once you've got a problem on your hands. Put good measures in place early on so it can become protective. And that way, you're going to reduce the negative impact emotionally of this pandemic.
And that was Professor Anthony Feinstein speaking with me from Canada.